All right. Welcome to Dental Anatomy Review 6. Um, Remember, these lectures are also available at dboardexams.com. Okay. So we're going to review some of the clinical considerations. Okay. So maxillary first premolars, the mesial view, as we mentioned earlier. So we mentioned that the maxillary first premolars have a crown concavity that extends to the root concavity, okay, due to the mesial marginal groove. Okay, so when you're doing the clinical significance of these is that when you're performing a class 2 amalgam restoration, it can be very difficult to adapt a matrix band on the mesial surface of the maxillary first premolar. Okay, this is because of the mesial concavity. All right, and this may contribute to an overhang. An overhang is a trap for food, okay, which further causes periodontal disease and also decay. So you have to keep that in mind. You have to keep the anatomy of the tooth in mind when you're doing the restoration. The maxillary first molar, the distal view, we also mentioned that the this tooth has a cervical concavity which is present on the distal surface of the crown. Okay, so maxillary first premolar has a mesial crown concavity. The maxillary first molar has a distal crown concavity. Okay, and also it may be very difficult, okay, to obtain close adaptation of the matrix band also in this situation. All right, therefore you can create an overhang in this area too. uh, Maxillary lateral incisor, I think I mentioned this before. So the tooth has the most variation of any other tooth in the mouth, except of course for third molars. So this tooth has a gingival, a lingual gingival groove or a palatal gingival groove, which is the anatomical feature of the maxillolateral incisor that is most likely to complicate root planning. Okay, and the groove is also referred to palatal gingival groove. Some people call it a distal lingual groove. And so more clinical considerations. So the caries, okay, caries is more likely to occur in the lingo of the maxillary molar than on the distal. I'm sorry, than on the buccal. So the lingo, that's because of of the the distal lingual groove. Okay, remember there's a distal lingual groove right next to the oblique ridge. So caries is more likely to occur on the buccal of the mandibular molar than on the lingual, and that's because the buccal of the mandibular molar, there's on the first molar there is a lingual a buccal pit. Okay, the transverse ridge of the mandibular first premolar often